Hey there, welcome back to the channel. If you or someone you care about is living with a rheumatic or autoimmune condition, this video is a big one. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. We're breaking down the 2022 ACR Vaccine Guidelines, what they mean, why they matter, and how they affect your treatment plan. Here's the deal. When you're on meds that calm your immune system, like for lupus or rheumatoid arthritis, your body can have a harder time fighting off infections. That's where vaccines come in. They're one of the best ways to stay protected. But not all vaccines work the same when you're immunosuppressed, and timing is everything. So let's walk through the top recommendations. First up, pneumococcal vaccines. If you're under 65 and on immunosuppressants, you should get them. They protect against pneumonia, bloodstream infections, even meningitis. New options like PCV15 and PCV20 are now in the mix. Next, Shingrix, the shingles vaccine. It's recommended for anyone over 18 who's immunosuppressed. Even if you're younger than 50, your risk is higher on these meds. Flu shot, every year, no question. If you're over 65 or on strong meds, high-dose or adjuvanted flu vaccines are best. But if you can't get one of those, just get the regular shot. It's way better than skipping it. HPV vaccine also gets a mention. If you're between 26 and 45 and haven't had it before, ask your doc. It's conditionally recommended because of the higher cancer risk with immunosuppression. Now let's talk meds and timing. If you're on methotrexate, the guideline says to pause it for 2 weeks after your flu shot, as long as your disease is stable. Why? So your immune system can respond better to the vaccine. Rituximab's a big one. Try to get vaccinated before starting it. If you're already on it, wait at least 6 months after your last dose before getting most vaccines. For most other meds, no need to stop. Just go ahead and vaccinate. Steroids are a bit different. If you're on 10 milligrams of prednisone or less per day, you're good to go. Between 10 and 20, still okay. Over 20, you can get the flu shot, but it might be best to delay others until your dose comes down. And what if you're in a flare? Don't panic, most vaccines are still safe. The risk of infection usually outweighs any small risk of worsening symptoms. But always check with your rheumatologist. Live vaccines like MMR, chickenpox, or the nasal flu spray, those are a no-go if you're significantly immunosuppressed. If you have to get one, you'll need to pause meds for 4 weeks before and after. And if you're on rituximab, wait 6 months after your last dose. For pregnant patients on biologics, there are special rules for newborn vaccines. If your baby was exposed to TNF inhibitors, they can get the rotavirus vaccine on schedule. But if it was rituximab, hold off until your baby's at least 6 months old. One more thing, yes, you can get multiple vaccines at once. In fact, it's encouraged. It cuts down on appointments and keeps you covered faster. You might feel a bit sore after, but that's totally normal. So here's your recap. Talk to your rheumatologist before making changes to meds. Prioritize vaccines, even if your disease is flaring. Methotrexate and rituximab need special timing. Avoid live vaccines unless your doctor gives the green light. And never skip the flu shot. That's your guide to vaccines with rheumatic disease. If this helped, hit like, subscribe, and share it with someone who needs to hear this. And check the description for the ACR one-pager. It's got everything in one spot.